Welcome to EO Talks, Eastern Oregon's very own talk show, only here on EO Alive.
Hey, Eastern Oregon, thanks for jumping in with us today on EO Talks. And like always, on every other Tuesday, I have Carrie Brzotti with me from CHD. Hey, Carrie, thanks so much for jumping in today. How you doing?
I'm pretty good. How are you? We've been busy since we last talked. We've definitely had a lot going on.
Well, what's been keeping you busy? Let's just kind of start there. What are you doing?
Well, we are continuing to push out COVID-19 vaccine. It's definitely been a pretty significant aspect of our work. I think, it is important for folks in the community to know and understand that we're still doing the work that we were doing before the vaccine came around. We're still doing case investigations, contact tracing, really trying to prevent the spread of COVID-19 in the ways that we were before the vaccine. But now we're trying to add vaccine on top of all of that work. So we've been really fortunate that we have had vaccine to distribute over the last few weeks. And we're really trying to get vaccine out to the community as quickly as we're getting it. So we've done a few large vaccine events where we've focused on vaccinating the current priority groups, the current groups that are eligible to get vaccinated, which are set out by the Oregon Health Authority. So those include the phase 1A groups, which are really healthcare providers, but then other folks that care for people that work in outpatient settings. It's actually a pretty broad group of folks that we have in phase 1A. And then over the last week or so, we have been able to move on to vaccinating our educators, early childhood staff, so early learning, childcare, K through 12 education. And so it's just taken a lot of time, but like I said, our team is really committed to working hard to get the vaccine out as quickly as we can. And we've had a lot of support from the county emergency manager. We've had some volunteers that are showing up to help us. So it's been a pretty big effort, but we're really glad that we have folks in the community that have gotten their first dose of vaccine. I'm also really excited that here pretty soon we'll be starting to give second doses so people have that full protection from the vaccine. So just lots of work to get it out.
Cool. And so when people are receiving the vaccine, where are they receiving it at? Are they coming to CHD, or what is there a main point of contact where they're receiving it?
So, we definitely did do some events at our facility at CHD, but the last few events have actually been held at the Riviera Activity Center, which provides us with a larger space. So we're basically able to get more folks vaccinated during one period of time. It just allows us to get more folks vaccinated. So we've been using that space, and it's really been working out well. It's a great facility. Every time we do an event, we find something that we can improve on a little bit more. And our team has just done such a great job of creating a system that will allow people to get their vaccine as efficiently as possible. So yeah, it's been great to give people their vaccine, honestly. Really been a bright spot in the last year.
I can imagine. So are there any elderly folks that are also receiving the vaccine along with the other two groups that you mentioned?
Yeah, so I think it's obviously when we're having to prioritize people, and the phasing can be really complicated. If you look through Oregon's phase 1A plan, there are a lot of ways that people can get vaccinated now. So I've really encouraged folks to look at that guidance document carefully. You may be 80 years old, but you may also fall into one of the other categories that would allow you to get vaccinated. So I'm really encouraging people not to think of themselves as being in one specific box, so to speak. So don't just say, oh, well, I'm 80, so I need to wait. Well, yeah, if you don't fit any of the other criteria, we would ask you to wait until next week when the 80 plus population is eligible, but there may be other categories that you would fit in under phase 1A. So I would definitely encourage people to check out that document. They can find that document. It's pretty easy to do a Google search and find it, but if you go to our website, which is chdinc.org/COVID-19, we have all the information there and a link to that document. And again, it's just hard for us to make that determination for everybody. So we're really encouraging people to look at that document and really look at all of the criteria and see if they fit.
And so give me an example of a criteria. So like, you know, if they're a certain age, they're not in the group, but if they have a particular health condition, I mean, give me an example of how that works, if you would.
Yeah, I'm actually going to pull it up because I don't really want to share misinformation. But as a good example, if you are a caregiver of somebody who is medically fragile, who lives at home, you and the person that you care for are eligible for the vaccine. So again, these are just people that are in extremely high risk and may need care from others. And so what I think group one is really the healthcare provider group and the people that those healthcare providers may care for. So that definitely applies to a hospital setting or a clinic setting, outpatient clinic, but it can also apply to an in-home setting. So, you know, if somebody lives independently, but they really do need a care provider because of their medical condition, then they would fit into this group, the person they're caring for and the care provider. And these don't need to be paid healthcare providers. I mean, those are definitely covered in this as well, you know, home care workers or personal support workers, but they also cover unpaid workers. And so again, I think it's just really helpful for folks to look at this guidance document. I'm looking in group 3 specifically, but I just want to let folks know that they shouldn't just assume that if they're not working in a hospital setting or they don't work in a clinic setting that they're not eligible under that group 1A, and just, you know, take a look at it and see.
Good. And again, where was that website information, Carrie, that where they can find that?
So I'm sure there's a link to it on the CHD COVID-19 website. There's quite a few links on there, but like I said, if you just Google Oregon's phase 1A vaccine plan, you'll probably find it. It'll probably be the first thing that pops up.
Okay. And then, and this might give us some of that information. So
yeah,
talk to us about what group is next. And yeah. I hope you guys can read that. Here, let me see if I can make it full frame. So,
yeah.
so then right now we're here in group 1A, right?
Yeah, so we're continuing to do group 1A, like you said. And like I said, if you look in group 3, I think the one thing that I do encourage people to do is if they think they could fall into it, look at the more detailed guidance document. But you can see here it says paid or unpaid caregivers. And this can include parents or foster parents of medically fragile children or adults who live at home. And so, you know, I think sometimes we might be in that role and we didn't necessarily think that we would be in this phase 1A group because we talked so much about how it's healthcare providers and, you know, people working in hospital settings. And I think, again, this group is much broader. So just encourage people to look at that. And then we're also vaccinating phase 1B group 1. So we've actually made quite a bit of progress in Union County on getting that group 1 vaccinated. I wouldn't say that we're done because we still have more folks that are reaching out and letting us know that they're still interested in that group and wanting to get vaccinated. But so we'll continue. Just because we move on to another group doesn't mean we stop vaccinating the previous phases. So anybody in phase 1A will continue to be eligible for our vaccine events. Anybody in phase 1B group 1 will continue to be eligible for our vaccine events. And then next week, we will be able to open it up to that group 2, which is people 80 and older.
Okay, good.
So I
right.
do think, yeah, the one other thing I really just want to remind people about is that our ability to provide vaccine to these groups is contingent on us having that vaccine.
Right.
And I really empathize with the people in our community that want their vaccine and they want it now. And they've been waiting really patiently for it to be their turn. And I want to give everybody the vaccine the second that their eligibility group opens up. And like I said, I can tell you that our team, the second we know what our allocation is going to be for the next week, we are scheduling clinics because we want the vaccine to get out. We don't want vaccine sitting on our shelf. And this is really just, we're all so committed to it. But I'm also a little bit uncertain about what our allocations will look like in the next few weeks, because even though the phase 1B group 2 will be eligible next week, according to the governor's guidance, it also sounds like there's still some areas of the state where they're not completely done with the previous phases, phase 1A and the phase 1B group 1. And so what we don't know is whether or not we'll be getting vaccine allocations. So we don't really learn that until later in the week. So at this point in time, it's really difficult to know how many folks in that next group will be able to offer vaccines to next week. And so I just, we're going to have to ask our community to continue to be patient and just, we'll get it to you as soon as we get the vaccine, but we're a little bit, some of this is out of our control. It's really out of our hands. Like we can't give vaccine unless we're getting it as an allocation. So we will get it out as soon as we get it, but it's still a week by week. We're getting that information on a week by week basis. So we don't necessarily know what we'll have next week.
And I would imagine that you are having to hold, I mean, you're having to make sure that you have enough supply, whether you're holding or not, but that you can give those people that got the first vaccine, the first shot, the second one. Is that, I mean, I would imagine that's part of the equation you deal with too.
Yeah, and I appreciate you bringing up the second doses because at this point in time, CHD is probably given approximately 1,500 first doses of COVID-19 vaccine in a pretty short period of time. So we're actually now getting to the point where we're going to start needing to give folks their second doses. So I think the other thing is there's the significant workload of so you're giving people the second doses and then, all those people you gave first doses to need their second dose, then you're still getting first doses that you need to administer. But the way that Oregon is managing the second dose is that each week they get an allocation from the federal government. And they're keeping track of how many second doses need to be given, say, this week. And so when they get their federal allocation, they say, okay, we know that this week our state needs this many second doses. And so they're putting that aside in this week's allocation and then sending it out. So we're actually not holding it on the shelf. So we didn't get like 1,000 doses last month and we are holding back 500. What is happening is that if we gave 500 doses 28 days ago, the state's going to give us 500 doses from their federal allocation this week to give as second doses. So what this means is that we may end up not having as many first doses coming because some of the doses that the federal government is giving Oregon will need to be given as second doses. Hopefully that makes sense to people.
Yeah, so they're essentially doling out what you need at the time, including the second doses.
Yeah, exactly.
Which makes it, and just to reemphasize, you've said it already, but you're just doing what you're told. I mean, that's you don't have much input into this. You're just they're sending you the vaccines. They're telling you who to distribute them to, and you guys are just doing your best to do what you're being told to do.
Yeah, I mean, we're following the guidance and we're giving out what we have and we're getting it out as quickly as we can. And and I understand this is not an ideal situation because if I had, what I want, I would have enough vaccine to give to everybody who wants it. But I think that the one thing I do want people to remember is that at some point in time, we will have enough vaccine to give it to everybody who wants it. And it's just going to take us all a little bit of time, a little bit longer. But the good news is that a lot of folks in our community have gotten that first dose, and that will protect our community as well. It won't just protect the individual that got it, but it will definitely slow the transmission in our community overall. So yeah, I know this is sometimes hard, but we are definitely following the guidance that we're given, and we'll continue to give out the vaccine until everybody who wants it has it.
So in our, I don't know what the percentages are, but if we have, 26,000, 25,000 in the immediate area, and you've already given, 1,500, that's significant. That's, yeah, so that's good. Well, so I know that you guys are concerned about people who are isolated, who might not be watching this show. They might not be connected to the internet or whatever the case might be. How can we help those people get information and be connected and know when there is a vaccine available to them, know where to go, and so on and so forth?
Yeah, I'm really glad that you brought that up. I think one of the things that we really want to ask our community is to help people around them make sure that they have the information they need to get vaccinated if it's something they're interested in. We know that as we move into this next population group, that there may be some of our community members that are not connected to social media, that may not readily access the internet. Again, the reality is that all of us obtain information in different ways, and we're all connected to different social media platforms, or some of us read the newspaper, some of us don't. I don't have, standard cable television. There's just all different, we get information in lots of different ways. And so I think this is just an opportunity for us to share information with people that we care about, people that we're connected with in the community, people that we know may not have access to the internet, or may not have a smartphone, or aren't watching EO Live. So if we could just ask our community members to check in on each other again. This is about taking care of each other. And if somebody is interested and they need help getting the information, if you can help them with that, then that will just be one more way we can get them protected as quickly as possible. And so again, we're updating information on our website on a regular basis. People can contact CHD if the website's not an option for them. So, we definitely still have a telephone. People can call that. And, we have actually an email listserv. And I know not everybody has access to email, but if you do and can share information with the person that doesn't, it just allows us to give, it helps us with some of the work if people can access the information on the website, so we can actually be operating the vaccine clinic. So the listserv is actually one of the best ways to keep up to date. And if you go to our website, which is chdinc.org, and you go to /subscribe, you just put your email in, and we'll send you an update when we open up to a new group, or when we're offering vaccine clinics that people can go sign up for. We're not going to send people a bunch of emails. It's really just a mechanism for us to get information out about the vaccine right now. And that's the best way to keep up to date. And then you don't have to leave a message on the phone. You don't have to wait for a call back. You'll just get the information when it's readily available.
So right now there are 2 vaccines that are available, Pfizer and Moderna. Which one are we distributing here locally?
Yeah, so right now we have the Moderna vaccine. As I'm sure a lot of folks know, the Pfizer vaccine requires a really, really specified refrigeration that we don't have in our community yet. I anticipate that at some point in the future we will have that, and we will have access to the Pfizer vaccine. But for now, we're getting the Moderna.
Okay, good. So our cases, how do you think we're doing? I see the cases come in nearly every day, and as you guys do the reporting, do you think, I don't know, give us a report card on are we improving? What do you think?
Yeah, what I think is that it's a really hard number to predict. Just when I think we're trending in one direction, we get a little bit of a spike. I ran the report today for the current 2-week period, which is the 2-week period that will be used to determine whether or not Union County moves between risk categories. And we had around, we're in the 40s right now. That includes probably a couple of cases that will be reported out tomorrow, but we're in that range. So, between now and the end of the week, is it possible that we don't climb above that 60 cases in that 2-week period? Absolutely, it's totally possible. But I have to tell you, there have been a few weeks over the last few months where I've been kind of hopeful that we would be below that 60 threshold. And we've had a little spike towards the end or the middle of the week. And so at this point in time, I'm just given up on predicting. I think that the one thing that I would just encourage people is to really continue to follow that prevention guidance. And I think, we're seeing a few outbreaks here and there. We're definitely seeing clusters of cases. And so I think, again, it's just really making sure that you stay home if you're sick. It really helps if people give us their contacts so we can let them know that they might be at risk, so then they can stop, the spread to other people if they do in fact develop the virus. So, really helping us with that contact tracing. And, we've been at this for almost a year now. I mean, I know that we at CHD were tracking the virus at this point in time, watching the map every day to see how many new cases there were in the world. And we were starting, just a month from now, a year ago, I got my first phone call that I kind of signal as the real start of our work on this. And so I understand people are fatigued. I totally get that people are, it gets hard to maintain the physical distancing. It gets, I'm sure people are tired of wearing their face coverings, or, there's just all these things that we didn't think we'd be doing this long, but it's really important that we continue doing them if we want to see our case counts go down. So just really, I feel like my work right now has been really focused on the vaccine, but the virus is still in our community. It's still spreading, and all of that prevention is still important while we work on building the immunity through the vaccine.
It's funny because earlier, I greeted someone and they stuck out their hand, and you kind of do that dance like they wanted to shake hands, and I stuck out my elbow, and he said, "Oh, okay, fine." It's like, yeah, I'm sorry, I don't want to show up on your list. I mean, I don't want you to be the person that says, "Yeah, I did shake hands with Brent Clapp," and then I'm going to be in isolation. So anyhow, it's just, so we still have to continue to be diligent about these things. We know what we need to do. The dance is awkward. Nobody likes it, and it's kind of funny. I had a Facebook conversation recently, and I hardly ever wade into those personally because I refuse to argue with somebody I don't even know. That's just stupid. But they were making some snide comment about rural Oregon, and not being compliant, and I defended us because I felt like we deserved to being defended. Yeah, it's like, that we might not be as compliant. We might be more grouchy about it. I mean, we might be more grouchy about being compliant, but for the large portion of folks, I think they're doing the right thing. They are being compliant. So, we might complain about it, but for the most part, I think we're trying to do the right thing.
Yeah, well, I think we do hear often about people who aren't doing things that we've asked them to do, or we hear about the people that just aren't doing things. And I think that it is definitely important to remember that there are a lot of people in our community that are really trying to do the right thing, and that this has been going on for a long time. And I think we are going to have to continue doing this for a while longer. And, I've said this probably a million times in our talks before, but it really is about taking care of each other. And that's, for me, like I'm putting on my face covering because I want to keep those around me safe. And I am not standing close to you because I do not want you to get sick if I have it. And I do not want you to be on my contact list when public health calls me. I don't want to have to give them any names except the people that live in my household. And I do think that it just, for me, it always comes back to the fact that I care about my community. I want my community to be safe. I want my community to be healthy. And it's honestly not a lot for me to do, to take these pretty small, simple steps to help my community that I care about deeply be safe and healthy.
And you and I have talked about this many times. And, my motivation is just to be courteous, to give way to whomever might, I'm not gonna, if somebody wears double masks, I might think, well, that's a little overkill, but I'm not going to make fun of them. That would be silly. That would be, that would be, I don't know, mean of me. And I just don't think that. On the same hand, if I begrudgingly wear my mask or I begrudgingly do something, I don't want people to make fun of me either. One of the greatest rights of being American is be able to complain about what you don't want to do. But in this particular case, if you're doing it if you're being compliant, then hey, yeah, at least I'm being compliant. So we just need to be courteous to one another, and that's kind of what I try and do. So anyhow, well, hey, thank you. Anything else we need to talk about before we take off?
I think that really covers it. I'm always grateful for the opportunity to come share information and chat with you. And I think that I just really want to encourage folks to, check our website, chdinc.org/COVID-19. We also have a COVID-19 vaccine page on there. And then the listserv is just a really great way to stay up to date on information. I know people are eagerly awaiting the next vaccine appointment or, the next group that's going to be open, or might have a question about whether or not they'll qualify or when they'll qualify. And that's really just the best way to have the most up-to-date information. We really are keeping it all on there along with regular updates on our social media. I think that's pretty much it.
All right. Well, Carrie, as always, thank you so much for coming on. And Carrie comes on every other Tuesday at 1:30, and appreciate you coming on. Eastern Oregon, just want to remind you there's a couple of things that are happening. This Friday night, we're carrying the Youth for Christ fundraiser. We'll be here live on EO Alive TV. And then next Valentine's Day night, which is the 14th of February, if you have forgotten, and if you have a sweetheart, you need to get them something then. We're gonna it's kind of a cool thing. So Tade McCandy and her band will be in the studio playing music, playing Valentine's Day music, and you have an opportunity to go pick up some dinner from the Landing or dining at the Landing. I'm trying to remember what the name of their restaurant is, but they have some specials. You can sign up for those specials ahead of time, go pick them up, get yourself in front of a TV next to a fire and have a nice romantic dinner with your sweetheart. So some cool streaming things that are coming up. So thanks a bunch for always joining us and always being with us, and we'll see you next time.
Welcome to EO Talks, Eastern Oregon's very own talk show, only here on EO Alive.